All right. Good afternoon. Thank you so much for taking time out of your schedule to join us today for the Michigan Maternal Health Podcast. I have such great treats for you today. I get to work with some phenomenal women in this field, and they have joined us for a conversation to educate and explore our options as a community for better health. Let me be conscious. My name is Athena McKay. I am the Executive Director of Flint Innovative Solutions. And as you can see here, we have our great doctors who work for our Flint community, Dr. Uphold and also Dr. McCoy White, who will be joining us in the conversation. And today we're going to focus on the Health Equity Report. You're going to learn what resources have been available to our community and how you may access them as well. This presentation is brought to you by the Miracle Center, which stands for the Maternal Health Multi-Level Intervention for Racial Equity, or the Miracle Project. There's actually 5 components to this project. I happen to have the opportunity to be the community PI for the second project, which is the Multi-Level Maternal Health app, the Michigan Healthy Mom, or My Mom. And you'll learn more about that in the series of podcasts and the great opportunity that's coming up in a few weeks with our appathon. And here we are. So our appathon is the information session for our appathon is May 7th. Please mark your calendars and also register to be part of that informational session so you can learn more about how you can help us improve pregnancy health of moms in our community. And here is that information from Dr. Uphold. So Heatherlun and her team has been working diligently, and we want to hear from you. You often know that tools are made and created for our community, by our community, but not everyone is at the table. So those who have created this tool also want your input, and we'll learn a lot more about that with Dr. Uphold's presentation shortly. So without further ado, I would like to share with you our first panelist, expert panel, Dr. McCoy White. Jonne, would you please share? Come on board. Thank you. Good morning. Well, no, it's not morning. Whatever day it is. How are you?
Good evening. It's great. How are you?
I'm doing well. Thank you so much for taking time out of your schedule. Some of the back conversation and your challenge, you're encouraged to help your daughter and be fit. It's so nice having spring on us finally. Could you share with our audience a little bit about yourself and why this initiative is personal and important to you?
All right. Hi. My name is Dr. Jonne McCoy White. Maternal health equity is very important to me. First, because I've had family members who have struggled with having children, having preterm children, and unfortunately, my sister who passed away from a massive heart attack also had a miscarriage, and that is part of the reason why she had a weak heart. And so for me, this is personal, and Black maternal health and bridging those gaps in health equity is one of the reasons why I have my doctorates in public health. I'm from Flint, born and raised, graduated from Flint Northern, and also a graduate of Michigan State University. So I am just passionate and so thankful for those who see we need to help our moms in this area. So that is who I am. And I am also a part of Project 3 of the Multi-Level Intervention for Racial Equity. And I'm the implementations practitioner for that portion of the Miracle Project.
Oh, I think we lost your audio, Athena.
Yep, that would happen when you put in mute.
I wasn't sure if it was me or not. So,
Heatherlun, thank you so much. Can
yeah,
you share a little bit about yourself and why this information that you're sharing today is so important?
absolutely. Athena, I adore you. Absolutely love to come and work and do sign me up for Athena. I'm a yes. So thanks for this opportunity to come in and share our health equity report card. I actually grew up in the Flint and Genesee County area my entire life. I've either gone to school, lived or worked or gone to church in the Flint community for longer than I care to. Well, I'm grateful for the number of years that I've been on earth, but I just don't want to give that number out quite yet. I love the work that we get to do in Flint through our work at the Charles Stewart Mott Department of Public Health. And Athena, you put it so well because you said we get to share the work that we work for the community. And I couldn't have said it any better myself. That is exactly why I'm here, why Jonne's here. And in fact, I tell my partners that one of the reasons that I have a job is because of them, because of the partnerships that we have and that we are working together to address the needs of our community, for the community, with community not only at the table, but at the head of the table. And that there's always room for more. And one of the things that we'll get into with our report card that we developed with community is that it supports data-driven dialogues. So that as we're having conversations about the needs that folks see, on a daily basis in our community, we can then come alongside with data to support those. But we'll get into that in a little bit.
Thank you so much, Heatherlun. So let's dive right into it. We had a lot of information to share with you all. I want to take a little personal journey with you in regards to my pregnancy experiences. As most of you know, I've had the opportunity to birth 3 wonderful little beings, not so little anymore. And my slides are acting up great. But as you can actually, let me do this really quick. I'll come back to it. This picture you see here is actually supposed to transition. So this is me still in undergrad, eager to take on the world and take on new challenges. It transitions to another picture, and then that one behind it is the most important one, is when that little guy made me a mother. And so give me 2 seconds because I think that's really important for you all to see. And we love technology. It is a great tool, and we're so thankful for it. I'm going to bring my 2 panelists in to help me through this little transition. Did anyone want to share any other personal things as far as mothers, godmothers, stepmoms, any of those things that kind of we pick up along the way on our journeys?
We were just talking, Jonne and I were just sharing earlier before we got started on this live about how wonderful kids are in motivating us and whether they want to or not, sometimes I think they come along for the journey.
Yes. With thinking of children and just being that role model for me, thinking back, just having our little ones. And I always say, okay, they're watching me, you know? And so sometimes I have to, stop some of my bad habits. Just like we were talking about track and kids trying to get ready for track. And I'm like, oh, I just want to sit on the couch, but training must happen. So here we are.
Yes. Well, and another great Flint resource, right? You're training for not just any race, but the 10 miler with PRAMM.
Yes. So it's there.
Yeah.
We're gonna have a great time in August. The training has to start now.
Mm-hmm. Yes. I was unfamiliar with the story about your sister. Thank you for sharing that. And
Yeah.
I'm sure that so many of the folks listening, the folks who will be listening later on, likely have similar experiences, where family members, maybe even themselves, have experienced something while either trying to get pregnant, during pregnancy, post-pregnancy, after having their children. So many things that folks experience.
The thing about it is that cardiovascular disease is now becoming one of the leading causes of maternal deaths. And really, like we just saw the young lady who was a cheerleader for the Chiefs, right? I believe she was for the Chiefs, and she passed away after having a stillbirth. And we know that if you're having a stillbirth, it's an increase of 14% for you to pass or have an adverse pregnancy related issue. So these are things that we, really don't get told, throughout the pregnancy, the importance of going to your prenatal care visit, the importance of going to your postpartum visit, and the warning signs, like things that you just, oh, you're swelling, but you're pregnant. Oh, you're swelling, but you just had a child. No, that swelling is not, no. Yes, there should be some swelling. You may have some, but let's go check to just make sure that you're okay. Don't even, yep, I'm pregnant, but this swelling is not normal. Let's go. And they'll tell me, okay, you got a little swelling, but we're going to keep an eye on your blood pressure.
Mm-hmm.
And people think about, well, you have high blood pressure during pregnancy, you might have it, but it really happens after pregnancy. After having the baby, that's when you have that increase. I have a niece who she had her child and she's a nurse, and she had to go back into the hospital for, I think, almost 3 weeks. Wow. So someone had to take care of her newborn because of preeclampsia.
Ooh.
And the thing is, only good thing, she was a nurse, so she knew how to advocate for herself. At first, they were going to blow her off, but they did, because she knew them. They moved quickly.
Thank goodness.
Mm-hmm.
So,
thank goodness. I'll go ahead and I want to jump in, and I'm like, no, don't jump in because you got specific stuff that you want to say. So let me thank you, ladies, so much again for your transparency and sharing the information with us. As you can see this slide here, I was a little younger than I am now, and I was ready to take on the world just out of finishing up my bachelor's degree. Again, here, ready to take on just eager, knowing that my education, my pedigree, and everything was going to propel me into what I wanted to be. And I did that for several years. And I want to talk about today my journey with my pregnancy, my multiple pregnancies. This picture here, some of you may know this little guy. He made me a mom. It was magical for me to actually understand that there was a life growing inside of me, that my partner at the time and I had this loving relationship, and we were going to be able to create something that was part of both of us to take on another element of the world. And so I I'm in the transition of moving. I couldn't find all my baby books, but I did find this picture, and it just if you can tell, my eyes changed a little bit. And so I went from this bright-eyed, bushy-tailed, ready to take on the world, to this, oh my God, I have this tremendous responsibility for caring for this human being who's innocent and pure and full of life, and I have to feed him, I have to change him, I have to clothe him. And it was an interesting journey. His name is Jonathan. And so doing all the things that I could to make sure he was educated, properly cared for, and nurtured. He was joined shortly after, 18 months, by his little sister, who he adored. And both of those pregnancies went off without a hitch. I did some research on my behalf because it was just what happened in my community. If you have intercourse, you have the chances of being pregnant, and then you have a kid, and it just moves on. There was no real education, so I took it upon myself to do Lamaze. I took it upon myself to learn about breastfeeding. That was something that was taboo in my family, and I was able to nurse my children. It's a little funny. I went in with the thought of, I'm going to have total natural pregnancy. No drugs, no epidural, no nothing. I'm just going to go through and I can do this. Let me tell you what. I think I was about a 7 with Jonathan, and I'm like, his partner, my partner at the time, I squeezed his hand so tight. He's like, I'm sorry. I'm so sorry. I did this to you. But obviously, luckily and blissfully, we got through it. Education was something not only that I took upon myself, but also on my children. And as I want to stress education, our people perish for lack of knowledge. And so we have educators on the line who are going to educate us on how important our health is, the data that is presented to us, and how we can make choices for our lives. So I want to take a step back. I'm the littlest one in that picture here. My beautiful mother is holding me, and my older brother and my sister. She had some complications with me. They actually had to break my feet when I was born, and I had a little cast when I was born. I'm not exactly sure what was wrong, but that was the condition that I was in. And so as the years went on, I learned about how much of a miracle my sister and my brothers were. That's me again in the front, my older sister, my adopted brother, and my older brother. So 4 of us grew up together. 3 of us survived, but my mother actually endured a stillbirth as well as a miscarriage of twins. And again, it was kind of like, and as I learned this, I understand why my oldest brother was so spoiled, because he survived, right? This all happened before my oldest brother was born. And so I'm eternally grateful for the education and the love and nourishment that my mom gave me and allowed me to be the mother that I am. And Jonathan and Aver here, they had to share me a little more with Mario. This is Mario. I believe he's a little under 1 here. He still has that little cute smile. And with the pregnancies, all 3 pregnancies, I did not know that it was a rarity for us not to have complications. It was a rarity for a Black mom to not have all of these other elements of potential failure and potential death. And so doing this work, I've learned more and more how we can take the seat back, right? We often forget about how privileged we are. This is me on my motorcycle with my son, and we're just cruising through life, not understanding that there's other people who are challenged. And Janae, when you were sharing about track, I was like, oh, I get it. I got 3 runners, and they were all in track and swim. And through education, again, I just want to emphasize that so much to our audience is so, so important for you not to only get the education for yourself, but for your family, for your community. And we continue to persevere to make sure that not only we as a family are educated, but those that we love. I wanted to share pictures of my nieces and pictures of my granddaughter and my nephews, my great nephews. But I want to be, again, very conscious to the audience to share with you that you are a miracle. If you're able to listen to this podcast right now, you may have experienced some setbacks or some tests and trials, but because you're here today, and it's kind of cliche because we're talking about the Miracle Center, but it's true. Your birth, you coming through this day and time is a miracle because there are so many things, so many social determinants of health that could have prevented you from being here today. So I'm just opening it up, and I am going to turn it over to Heatherlun. She's going to share another piece of our education with you today. And I'm going to also ask if you have any questions to please drop them in the chat, whether you're on Facebook or YouTube. And we will be sure to answer those throughout the presentation. Heatherlun, let me bring you up.
Perfect. Thanks, Athena. And I loved seeing those photos. Oh my goodness, how precious are your little ones? Well, not little ones. They're how precious are your sweet ones.
Thank you. Thank you.
All right. So thanks for the opportunity to talk about our health equity report card that we created for the Flint and Genesee County community. On the next slide, I have no conflicts of interest to declare, but I do want to shout out our funders who provided the resources for the HERC, as we call it, or the Health Equity Report Card, which include the Michigan Health Endowment Fund, as well as the Blue Cross Blue Shield of Michigan Foundation. So Athena mentioned the social determinants of health, and that's what you're seeing depicted right here. So this is the Healthy People 2030 outline of social determinants of health. And I kind of want to just touch on these pieces before we jump into exactly what the Health Equity Report Card is and what it does. Because when we talk about the SDOH, what we mean are the conditions in the environments where you're born, you go to school, you live, you work, you play, you worship, and you age. And these conditions impact your health outcomes and your health risks. The WHO, or the World Health Organization, describes it as those non-medical factors that influence health outcomes. So think safe housing, racism, violence, job opportunities, income, access to food, all of those things that really impact how long we live and our health overall. But there's something that's missing. And on the next slide, we'll talk about it. And we've kind of danced around it a little bit, which is information as an additional determinant of health. And why this is important is a couple reasons. It's more than just making sure, can you get to the information? It's more than that. It's saying, is that information accessible? Is it equitably accessible? Is it understandable? Is it culturally relevant? And is it in a language that you can understand? Is it in your native language? So it's saying, it's holding ourselves to a higher standard and saying, don't just stick some information on some website that if you have internet access, you can get to it. No, this is about saying, let's make the information, number one, so you can get to it, but really more importantly, is it usable to you? So is it taking into account, you can see what we've got listed on the slide, but just in case you can't see it, is it taking into account data literacy, right? I am not the biggest data person with all of the fancy analysis that you can do. So let's take that data and translate it into something that's meaningful to us as we continue to do our work. Let's also make sure that it crosses that digital divide, right? So that it's not just stuck on a website someplace. And finally, let's make it, and I'm going to say this 8 million times, but let's make the data so that it's usable in communities who are boots on the ground, doing the work, supporting our local residents. So we've talked about the health equity report card. On the next slide, we'll actually talk about what it is. So what we wanted to do was to develop a simple way to communicate local health disparity data in our community, so that it not only served as a central, oh, this slide didn't turn out very well, did it? Sorry about that, folks. Let me just, so the purpose in the upper left says to identify and communicate the state of health disparities or differences. When you hear disparities, think differences between different groups, so that it could serve as, the HERC serves as a central location for data. You'll find out that we gather data from a variety of different sources, and that ultimately it's a resource for existing community organizations, community activists, folks out doing the work. Let's help them out. And that's what we wanted to do with the HERC. Because ultimately, what we want to do is provide a source, a foundation for data-driven conversations and for policy change, and then adjustments to funding priorities, so that we're all starting in the same place in regards to understanding the data, understanding the kind of status of our community. So I mentioned that we got data from a variety of different sources. And on the next slide, we'll talk about where that data came from. So it actually was 26 different sources, places like the census, county health rankings, the CDC. Man, we were pulling data from a variety of different places. And what we found were 50 different indicators. And once we got those indicators, we then disaggregated them, or we broke them out by location and then by race. And for race, we did a comparison of Black and white population. And we chose that because those are the two largest populations in Flint and Genesee County. So we had those 50 indicators. We wanted to make it easy to understand and kind of categorize everything. And with our partners, we wound up putting the information into 6 different categories, which include health outcomes, health services and access, maternal and child health. That's the one that we're here to talk about today. But we also included mental health, physical health, and socioeconomic status. And the next slide, we'll talk about the approach that we took for, once we had that data, we did something where we calculated what's known as a disparity ratio. And the way, so when I mentioned, when you hear disparity, think of a difference, or think of a significant unfair difference. And what we did is that we did that calculation, and by dividing the one outcome for a group by another outcome for a group, and we added a letter grade based on that. And that letter grade told us how severe or not severe the differences were between those two groups. So when we looked at race, it was the difference between Black and white population. And when we looked at location, it was the differences between Flint and Genesee County and the state, and Genesee County and the nation. What I want to remind us of is that when we see something that's an A or a B, so little difference or not so much, it doesn't mean we're doing all right overall in that category, because what the HERC shows us are differences. So when you see an A, it could still mean that folks are doing poorly in that category. It just means that everybody's not doing well. It could also mean that everybody's doing really well, but the report card is really designed to look at differences between either race or between location. We hope in future report cards we can add, the overall outcome, but for this first shot, this first creation of the report card, this is what we've done. So Athena gave us a taste of what's included in the report card. And this is a lot. I get that this is a lot in the slide, but I wanted to give you an overview of what's included for all 6 of those categories. So you're seeing the maternal and child health, and we'll dive deeper into this up next. But on the first page is a breakdown by location. The second page is a breakdown by race. And the third page is a map. And we've done this for all 6 of those categories. So you can see, we've got some narrative or some little language at the bottom. One of the other purposes that the report card serves is so that folks can just borrow from it wildly. So if you're putting in a grant proposal, or you want to send out an annual report or communicate with somebody somehow doing something, and the report card can help you share your message. It's designed so that you can copy and paste language. You can do a screenshot of the maps or of the report card itself and just take it and use it however you want. We really developed this with community for community. And that really is what we're advocating for its use. There's a QR code on the next slide that will take you to the report card, or you can go to our website, which is flintresearch.org. And I think Athena has the report card pulled up, because we're going to jump on in. I'm not going to lie, the report card has a number of pages on it because we found all of this wonderful information and we wanted to include it. But we've done our best to make it as streamlined as possible. One of the things that you'll discover as we go through the report card is that some of the data is missing. So you'll look at some of the categories, mental health, maternal and child health, and you'll say, Heatherlun, there's way more to this story of mental health than what you're showing. I think that there are maybe 5 variables, 5 of those indicators that are included there. And I would wholeheartely agree, we need to include more data. But again, we used the data that we could find that was publicly accessible from the web, from either the census or the 26 other places we went to. Yes, so this is our website. If you click on the right, you'll go to the Health Equity Report Card, I think. Yep. And you can see that there is a download the HERC. Yep. And so you click and it should pull right up. So we're right in it. We're doing it live. You're around, so if you want to just flip pretty quick, you can maybe slide on the left there. We can do it a bit quicker. We've got some introduction and just a lot of the things that I've said already. We have some fast facts if you want to just jump right into the information, some demographics. Not everybody's familiar with the Flint, Genesee County area and our breakdown. So we've got it broken down by, we tried to think of the number of different ways that folks would want information. And so you can kind of see that we've done that here. If you want to just see where the A's, B's, and C's, D's, and F's are, you can see that there. But then we start jumping into the actual report card itself. And I outlined those 3 pages, that's consistent for each one of the different categories. And as you scroll down, you can see, if you'll take us through just some of the different pages. Yeah, it's not, I don't think it's showing up very well, our wording. So you'll have to go to the report card yourself, I think. Here you can see the fast facts by race. And if you can scroll down, Athena, I'm sensitive to time and I want to make sure Jonne has some space. So this is our first category, health services and access. And you can see we've got some information listed. Yep, so that's what it looks like. See those hash marks? That tells you that data wasn't available. We mentioned that this was an issue. We know that it's something that we need to demand, that we have not only better access to data, but that the data that's collected is on a local level, so that we can get Flint information, so that we can get information that we can break down or disaggregate by race. So you're seeing health services and access. When you get to the map, what we've mapped out here is lacking health insurance access. So the map on the left talks about the dark, and this language, I'm saying it straight from the report card. The darker the orange, the lower the access to health insurance. So that's the map on the left, the orange one. The map on the right, and this one's consistent across those 6 categories. The darker the gray color, the higher the percentage of individuals that are who identify as Black. And that one, like I said, is consistent. So, you know, it's very apparent. You'll start to see some unfortunate and really alarming. It's not new to many folks in the community, but here we're seeing it mapped out, particularly in this case where we're looking at access to information. Moving on, the next category, socioeconomic status. We have 5 variables here. Another one that you're going to say, Heatherlun, there's way more than just poverty, unemployment, and access to school. I know. I want to include more data. We just got to get it. When we look at by race, we're seeing A's and B's when we're doing a comparison in Flint. There's a D when you look at Genesee County for unemployment, with folks, with our Black population doing worse than the white population. Moving on, what we mapped out for socioeconomic status is socioeconomic distress. Something I don't think you can see, but what we included is a definition at the bottom here. And the definitions are kind of peppered throughout, because when you talk about socioeconomic distress, you think, what do you mean, Heatherlun? Like, that could mean a lot of things. So we included the definition of what that means. And I'll give it to you because I teased you a little bit. What it says is it's a census block group level variable referring to the amount of material or social deprivation. So when we think of social deprivation, it's lone parenthood, poverty, low educational attainment, bunch of other things. They take all of that into account, and then that gives you that socioeconomic distress. The next one is physical health. There are more there's more variables here, but look what else you see. There are more missing data. So you can see that we don't have a whole lot of data for Flint. And when we get to race, again, it's consistent. We don't have that information for Flint as well. But looking at the map, we're seeing it mapped out poor physical health, where the darker the pink color, the poorer the physical health. And then that map on the right stays the same. So if your organization is addressing physical health, is addressing health outcomes related to, you know, high blood pressure, obesity, the information in the HERC can support the message that you're sharing about the work that you're doing. The next one, I mentioned mental health. There are actually 4 variables here: depression, poor mental health, suicides, and suicide by firearm. We all know that there's more that goes into this story. This is what we could just access. And we couldn't even find, the data didn't exist for Flint and Genesee County. Rather, it does exist. We just couldn't get to it. We are seeing some C's in this when we look at suicides by firearm for race. And then what we mapped out was poor mental health. And then, of course, the darker the blue color, the poorer the mental health. And you can see, we'll scroll in on the maternal and child health, because that's what we're looking for. But if you're in the report card and you look and you're like, I'm looking at this map and it's got some hash marks. One part is the airport, and then the other part is the used to be Chevy. So just keep in mind when you're looking at that information. So here we get to maternal and child health, and we have 7 variables here from child abuse. And if you want to zoom in, Athena, we can. We have child abuse, children in poverty, child mortality, infant mortality, low birth weight babies, maternal vulnerability, and teenage births. And with maternal vulnerability, a high score means greater risk of poor maternal health outcomes. And it's based on, again, it's one of those combination things. So they take into account healthcare, physical and mental health, substance abuse, socioeconomic determinants, and environment. Take all of those into account. But you can see we could only find it for Genesee County and Michigan. So when you move on to the next one and you look at race, this is where things really, this is our worst category. It's our worst category because of lack of data indicators. It's our worst category because of lack of data. And it's our worst category because we see Fs. Now, when you see an F and it has an asterisk, which these don't, none of these do. If you were to see an F, it would indicate that the white population was doing worse. This means that when you see those Fs for child mortality, infant mortality, it means that the Black population is doing, there's a high level of disparity. We've defined an F as a critical disparity. It requires immediate intervention. We also see a D for teenage births. But again, this is the only data that we could get to. And we know that so many other things go into the picture of maternal and child health. When we look at the map that we've created, we mapped out single women births. We would have liked to have done an additional map, but this was the only data that we could get that was down to census tract. In the Flint community, zip codes can vary, and they don't always give us the full story. So a census tract, and we include this information in the report card. This was the only variable that we could map out. So again, the darker the red color, the more single women who have given birth in the population. And then our final category is health outcomes. This is our largest one, and it includes everything from cancer mortality to high blood pressure mortality, injury deaths. It's a wide range of things. This is kind of a catch-all, and likely we'll be adding new categories as we move forward. But one thing I want to draw your attention to is this map, because hopefully this will be really usable to a lot of folks that are listening. We mapped out life expectancy. And you might have heard, the significant number of years that can differ in life expectancy for folks living in Flint. And this demonstrates that, where the darker the purple color, the higher the life expectancy. The higher the life expectancy. And look at the story that that's telling us. So these are just some of the things that are included in the report card. We hope to we're working on another report card for Port Huron, looking at substance use disorder. So we're going to do the same thing for Flint and Genesee County. But this is a tool that we created for the community to serve as a basis for conversation. Many cases, it's not going to tell you anything new. You might say, Heatherlun, I know this, I live this. This is my daily life. But what we're doing is we're coming alongside, and we're providing information so that as you address these things, write the grants, talk to policymakers, talk to your neighbors, that we can support those conversations through the information that's in the report card. And we also, so back to the slides, if possible, we also want to acknowledge that this is, yes, we do want your input. Please fill out the survey because we want to know how we can make this better. But I also want to acknowledge the amazing work that's going on in the community. The report card only tells a small portion of that story. And again, what we hope to do is come alongside and support in any way that we can, because we are here for the community, just like Athena said. I think my email address is listed on the last one, but it's upholdhe@msu.edu. I would love to hear from you. Love to talk about ways that we can support your work, or include more information in the report card, or make it better.
Thank you so much, Heatherlun. Tremendous amount of information and educational supplements. Thank you. I'm going to say it probably 600 more times. But before we, again, we'll drop the link in the chat there on Facebook Live. And I'm going to shoot right over to Jonne so she can share her information. Thank you so much again, Heatherlun. I appreciate your time, ma'am.
Hello, and thank you, Heatherlun. That was really great and a whole mouthful. So I thank you so much for doing this for us. And yes, we are working with community, and that is what's so great about, I just say, the MSU team. And so today I am here. My name is Jonne McCoy White again, and I am here talking about Apathon. And first, I want to disclose I have no no interest at all, no conflict of interest at all. And here is some of the Apathon team, which is now growing. And so I'm so excited. I just wanted to just make sure that people can see who is all on the team and who all works tirelessly on these issues. All right, next slide. And so first we just have our background on what we're going to do and what we're going to talk about. And it's just telling us what the Apathon is, the objectives of achieving true co-creation, our methods and how we did our first initial Apathon structures, and then what participants told us about their feedback and what we need to do and how we need to move forward. All right, next slide. So what is an Apathon? An Apathon is an event that brings people together to solve a problem. So our Apathon is similar to an event called a hackathon because community members we had talked to and they surveyed and asked, we want to have a hackathon. And they thought, let's not say hackathon because people think we're going to hack into something or something, for that. And so they came up with the name and then they came up with Apathon. So we started off already working with community to ensure we are inclusive. And the thing is, with a hackathon, it lasts between 24 and 48 hours, and it's dedicated to a specific topic or challenge. The participants are usually digital intervention creators with specialized technical skills. They typically develop intervention content, seeing community feedback at a specific intervals. They work in small groups to create new concepts, ideas, and prototypes. The results of the hackathon is a new product, service, or business model. Groups often present their final product to a panel of judges, and a winner is selected. And most of the time, there is a big cash prize. However, MSU Apathon is where the Flint community members will work together at an Apathon event to develop web-based apps and interventions to promote health equity. Participants will work in teams with app developers, video producers, and researchers to create web apps that address health issues in their community. But the good thing about this is there is no coding skills needed. The reason why this is done by the computerized intervention authoring system, which is called SciS 3.0. This allows digital intervention creation without coding. So we thought, what happens when community members use this new tool to directly develop digital interventions in collaborative events called Apathons, which we say similar to hackathons. Next slide. So we look at community engagement. And so we look at community engagement before SciS. And so that's where you have your researchers, your medical teams, other professionals, and that design content and or an intervention. And then the community members then provide feedback or guidance on that content. And then the software is then modified based on that feedback. But community engagement with SciS, where SciS allows community members and anyone else to directly create and edit content. SciS is an open source and non-commercial and is designed to promote research. SciS is optimized for collaboration and sharing. So remember, there's no coding needed, which is great. So our next slide, our methods of what we did. So we had two Apathons, one in February of last year and one in July of 2022. And so those Apathons included two teams of participants made up of community members and medical students. 10 of these participants provided feedback by responding to open-ended questions regarding events and strengths. And so we had our results where we had 3 themes that came out of this. And so it's the next slide. Our first one was participants described the MSU Apathon as an asset for the Flint community to help with health equity. And what they felt was some of us who have lived experience with that health issue or just had that lived experience because of a family member, they were able to help and build through Apathon, they were able to build a content that would be able to help others with whatever their that health issue was. And so this is where the community felt this is where they had a voice. And so Apathon gives people a voice and be inclusive. All right, next slide. Our second theme, participants felt that the competition aspect with prizes should continue. So when we did the Apathon, we did it just like a hackathon where there was a team that won, and that team won a financial gain and a financial prize, which was great. But to see that happen there, and what they got out of it was that made people think outside of the box. They were more creative, and that got more people involved because, okay, yeah, now I can spend a whole day and I'm going to get paid. But at the same time, I'm helping my community and I'm building my community with health equity. And that gives people that they already have pride for their community. So now what's next? I can still build upon that pride and then help my community at the same time. The third theme, next slide, sorry. The third theme was participants suggest that community members should be able to form their own teams and have more time to develop their interventions. So the one thing I can talk about right now, which I'm excited to see, that there is going to be another Apathon that's going to be taking place. And so now they're going to be doing actual information sessions on that. But what's great about this is that they can choose their own team. They can, have a little bit more time in developing because we gave just a window of time that they had to develop their content. They were trained very, on science, but it was very, quick. So now this here is a little bit more thought out, which I think is great. So our next slide. The conclusion, what's next? So we're going to continue with the broad contest model, self-forming teams with more time for intervention development, and then more participants. And we hope that there will help people to see that they have a voice and that it really matters. And what this here is just one of what we did in February, and it's some of the medical students and some community members. So we have a mix of both, which was really great to have that and have that this competition. But it also, the medical students was able to see what community members felt about this here was on mental health and what community felt about that. And so how do they find true facts about that? So next slide. This is just saying our references and what we referred to and how we refer to getting to true co-creation. Now, our last slide, I wanted to acknowledge our MSU Apathon team. Always love to thank our community members and community participants, as well as HFRCC was the community organization that partnered with us for those two Apathons. Again, thank you.
My mouse wouldn't come back to the screen. Thank you so much, Jonne. That is so much good information. And I don't know if you guys noticed, audience, but we kind of gave you the heads up. We gave you a cheat sheet with Heatherlun's information. So you have some data going into the Apathon that others may not have. So I kind of did that on purpose. I want to, again, just in our last 5 minutes, thank you both ladies so much for your work in this particular project and the many other projects you do to uplift our community. Advocates, advocates, advocates. This is urgent. So as Heatherlun mentioned, the HERC is in its first version, but we're working on the second version, and we need your input. Chris, my admin Chris put the link in the chat on Facebook. So please do a survey. Go through. Heatherlun did a great job of the overview, but go in, kick the tires, look under the hood, and give us your candid feedback on what we can do to improve this tool for you. And then, as Jonne mentioned, we have this informational session. We gave you a cheat sheet with the HERC as in your back pocket. And Jonne and her team has been whipping up breaking down barriers too. Like, I'm a techie, right? I love to be in the computer and make things and create things. Not everybody is like that. And so with SciAS, with Steve's, and you'll meet Steve in another podcast. He had a conflict today, but he created this tool so that barrier is gone and you don't have to be afraid of the computer to create an app. And then Jonne and her team, phenomenal team I've got to work with more closely in the last few months, are there to support you through SciAS in the creation. So we have a few more minutes, and I want to let you ladies share any of your additional thoughts and encouragement to the community before we wrap up.
Yeah, absolutely. Number one, thank you, Athena. You put this together so masterfully, and I think that Jonne and I get along anyways, but it's nice when the stuff that we are sharing also complements it. I can't underscore enough that we really are here to serve the community. So if there's something that you see that you're like, this ain't doing it for me, please. We've said it, but I say it really deeply from my heart that this is the start of us addressing data equity and return on investment for community who over and over have shared their stories, shared their experiences. You heard stories and experiences here from both of our friends with Athena and Jonne. So let's return those stories back to you in data that you can then use to change the community and create a healthier environment for generations to come.
Thank you, Heatherlun.
Yeah. I want to ditto with Heatherlun and say thank you, Athena, number one, for having me. And number two, this is a great forum for people to get information, and get health information. So that is great to have this. And I'm so appreciative of this, but also just letting people get involved, get involved and just listen and then see where you can fit. Because so many people think, well, I can't because I'm not a researcher, but you're a human and you have lived experiences. So that's even better because that helps us propel for policy change. Not only at, state, local, and federal level, but you can do policy change within an organization because you will say, hey, this is what's going on in Genesee County. And it's happening in all three of the hospitals. I'm not saying that it is. I'm just giving that as an example. And so now what do we do? And how can we change that? And so getting that voice and having the voice where the hospitals will start listening. So in healthcare systems. So
thank you. Whew, we did it. Sorry for the technical difficulties. Technology is our friend. I'm going to keep on saying that. Heatherlun, thank you so much for having me be a part of the outreach for HERC and for creating the tool. That again gives us a leg out to know what we're dealing with. And again, as we've shared, it's a reality check. Because I know what I see, I know what I hear out in community, being boots on the ground. But for you to put that data together to say, okay, I'm not tripping. No, really, look at the numbers. They're right here. So thank you so much for that. And Miss Jonne, thank you. Really, side note, I was stranded at the airport and Jonne gave me a ride from Detroit. So there is love there.
Like I was gonna say no. That's not what?
Thank you publicly for that. Nobody knew, but it just came at that moment. Sisters, I appreciate you in this work and in community. Everyone, again, there's so much information we were able to share. Share this podcast with others so they can be educated. Get involved, as Jonne mentioned. Go and kick the tires at HERC and let Heatherlun and her team know so that we can build a better community together. Thank you so much for joining us, and we'll see you next time.